Uh, Today, I would like to share the result from the research title on the satisfactions with the universal health coverage used among Thais in Bangkok Metropolitan area in Thailand. Most of the information about the UC, Professor Satiragon is shared for you already. Maybe I skip. Some questions about the big proportions of the healthcare security is the UC around 48 million now. And this is the 5 level of the health service system in Thailand. This start with the family and village. Is the self-care or primary care, healthcare. And for the sub-district, we have the primary care service by the health center. For the district, we have the secondary care service by the community hospital. For the province, we have the excellence center or tertiary care that's serviced by the universal hospital or general hospital or relations hospital. This level of the service care is related with the referral system in Thailand. The persons who are under the UC coverage, the persons who register in each step, when they want to go to another step of care, they require the referral letter from each center that they register. For the successful of the UC, one indicator is the customer satisfaction. It is generally niche of the outcome of the healthcare delivery in the service. The customer opinion is the one important indicator of the quality of the healthcare delivery. There's many professors mentions about this report book. In the 2010, this is the first 10 years of the UC in Thailand. One part that report about the satisfaction of UC customer was found that most of the UC in that time have the high level of the satisfaction on their UC right. And from review literature, we found that some study that related about the UC satisfaction in Thailand, some study in the patients, most of the study which the patients or the persons come to visit the health center, the government hospital, the university hospital. From this result, maybe they have the limitation of the representative of the overall of the performance of the UC certification. Why I talk like this? Because when they study, such as they study at the 1 unit of the health center, that means they specify this from this service, not all the UC, right? And in Bangkok is the special province in Thailand. They have many health services in Bangkok, especially for the primary healthcare service. It's quite different from another province. For the another province, primary healthcare service is under responsibility of the Ministry of Public Health. But in Bangkok, the public healthcare center is under the Bangkok Metropolitan Administration. They manage by themselves. In Bangkok, they have many health centers, such as the public health. There are around 68 health centers distributed in the East District in Bangkok. There is around 30 general hospitals and around 20 special hospitals and institutions, and have 5 university hospitals in Bangkok. And furthermore, that Ajahn Sithirakorn mentioned, we have many private hospitals and clinics in Bangkok. That means the persons in Bangkok have more chance to select their health service, depend on their health, depend on the health security, or depend on the economic of their family. That in Bangkok is the capital in Thailand. There is the special about the management in the Harvard province. It consists of around 15 districts in Bangkok, have around nearly 6 million registered population, but the total population that live in Bangkok around 9 million. And in the Bangkok, they have the variety of the background of the people in Bangkok, high education, high socio-economic, low economic, uneducated persons. And one thing is very variety that is about the healthcare service. Some persons can register in the healthcare center, but some persons can register their right in the university hospital. It depends on the time that they born. Such as in now, the new baby, such as they born in the Rama Hospital, is the university hospital, Mahidol University Hospital, but they cannot register at the Rama Hospital or center that they live because that center is maximum number already. They need to find out another health center, such as they live in here. Maybe they go to another district, and is very important and very problem in Bangkok now for the new baby. So this study wants to explore about the level of the certification toward UC coverage among Thai residents in Bangkok and identify some factors that related about which their satisfactions toward the UC coverage. This study is a descriptive study. Study is the one part of the health status survey people in the Bangkok Metropolitan project. We conduct the information from the people who is the Thai nationally and live in Bangkok at least 1 year. Our sample size is 10,000. We collect data by the multiple state random sampling. We choose all 15 districts to study and choose 2 sub-districts per each district and 2 communities per sub-district. Subject will sampling with the proportional to size by age. This is the proportional of the age structure in Bangkok. We try to sampling similar the proportion age of the Bangkok. And for the instrument from this study, it consists of it is a self-report questionnaire. That means about we ask about that perceived for everything that we ask, such as the general information, health status, health problem, health insurance, satisfactions on UC, information, source of the information that they get about the UC, and we have the open end to the subject share about the improvement that related to the UC or to another healthcare service suggestions, most common problem and impression service that they want to share for us. This is a questionnaire about the specify. We have the questions and they will the subject will rate by their perceived. And about the questions, we apply 3 aspects from the Johnson theory. That means the accommodation, affordability, acceptability, and another to aspect that the Bangkok Metropolitan want to know. That means information providing and coverage. And we classify in 3 levels of the satisfaction, good, fair, and unsatisfied. Okay. This is our team research. One is maybe in this room know him, President our Dean Pitaya and our Dean Prayun is the consultant of our team. And for the team research, it come from the many departments of the public health of Mahidol University. We have the researcher assistant who is the bachelor degree and master degree student help us to collect data in the community. We try to approach all community in Bangkok, especially in communities such as condominium, apartment, in the own house, big house, in the slum, crowded community, because we want to get the information that can representative to the people in the Bangkok. Okay, and then we analyze the data by the descriptive statistics and inferential statistics by use chi-square test. For the result of the study, for the general information, among subjects, 10,000, we found that they come from the general community around 50%, and 30% come from the special communities such as condominium, dormitory, or apartment, and around 15% come from the crowded community or slum. For our age proportion is follow our research method. We found 1, 1, 1, 1, and 2, 4 and 2. Most of the subject is the Buddhist. Around 25% is they are studying, and some graduate from the primary school, secondary school, and bachelor degree. Around 25% of the subject is the official, 20% is the labor, and their income is around, the median of income around 11,000 baht. And most of them sufficient income per month. And for the physical health and mental health, they mentioned that they think they have the good status of the health. And about the health problem, have health problem and underlying disease around 30%. And just only 1% that have suffer from the disability. And for the health insurance, from this study, we found that among the subjects, they mentioned they know they having the health insurance around 80%. Some persons mentioned they don't know around 40%, and around 4% they think they don't have any health insurance. And among the subjects, we found that in Bangkok, around 50% they hold the UC rights. And after that, we will pick this information to analyze about the specify among the UC consumer only. That means we will study only the persons who is the consumer of UC. Among consumer UC, during past year, around 75% they use for UC at the health service center. Information about the UC, most of them they got from the mass media, newspaper, magazine, and some in health volunteer. Health volunteer in Thailand is quite strong, just volunteer in the community to help the health center to keep the information or to make the appointment or to make the health promotion program. For the satisfaction level, which you see among UC consumer in Bangkok, 50% have fair level. Around 20% that mentions, oh, I'm very happy with the UC rights, and around 23 or 24% they not unsatisfied. And when determined in each aspect, we found that in aspect of the affordability have the most proportion of the persons who unsatisfied. And for the information providing is quite okay. If we include good and fair together, is highest, and followed by the accommodation and acceptability. And for the open end, it's very surprised from the open end questions from this research, because a lot of subjects try to mention about the problem that they meet from the UC use, such as about the information. They mentioned, okay, for the UC information, they have several ways to receive. But the way to receive about the information, it depends on the characteristic or background of the person, such as mass media. The persons who can approach the information, the mass media, they mention this is the good source, such as for the National Health Security Office, they prepared one website. This website have many information about the UC, about the rights, about the step, and they prepare about the hotline too. If you have some problem, you can call to the hotline 24 hours. But for the website, some subject says, I cannot access the internet. That means the website is not suitable for me. Maybe in the community, such as in the crowded community, They want information for the public health officer, but they have the limitation. The officer in the health center is very hard work. The patient is so crowded in each day. When you ask information, sometimes it's not fairly respond, something like that. They don't specify. And for the accommodation, they mentioned about the appointment system, especially in the health center. They mentioned it's very difficult. If you walk in to meet the clinician, sometimes you're not got a queue. You need to make the appointment in another day. That means that day they lost job, they lost money already. They want the health center to improve the appointment system like a university hospital. That means in the university hospital, they use the online appointment, or maybe you can use telephone service for make the appointment or postpone your appointment. For the acceptability, the important point as the subject to keep for us, that means about the provide care service in equity. This is one keyword of the UC. UC want to make the equity of the service, but some person think they're not the equity. Such as that I mentioned in the first, they want register in this area, but they cannot. They want go to meet the specialist in the general hospital or in the university hospital. But if the clinical in the health center not allow the referral letter, you cannot go. If you go to meet the specialist clinical, that means you need to pay by yourself. They think this is not equity. Your life depends on the clinician in the health center, public health center. And for the affordability, direct cost and indirect cost. For the direct cost, they mentioned some treatment that's uncovered by the UC, and about the UC not covered for the service after service house. Because sometimes they think they need to work in the daytime. They cannot go to meet the clinician to check up or something. If you go to the after service house, you need to pay money by yourself. And another thing is about the emergency case. If the subject perceive that illness is the emergency case, such as you get a high fever or your children get a high fever, you go to the general hospital that not cover your right. You go and the clinician direct. This is not the emergency case. That means you need to pay by yourself again. And for the indirect cost, the person said if come to the service house, that means they need to stop work. They lost about the money that they to meet the clinician and waiting all day for meet the clinician. And another thing in Thailand, in Bangkok, is so crowded. They not have the limitation about the parking. That means the persons come to visit the clinician in the health center or hospital cannot ride by themselves. They need to use the taxi, something like that. It's quite expensive. And for the coverage, they mentioned about the referral system that I mentioned before. They need to ask about the referral letter from the health center to go to another level service that they want. If they not allow you, that means you cannot go. If you want to go, you need to pay yourself. Okay, and then we try to find out the factor that associated with the satisfaction with UC. We found some variable that associated with the satisfaction of UC, such as age. We found elderly persons and younger persons quite have high level of the UC satisfied. It's be like this because that we talk in the morning about we try to prepare service for the elderly in Thailand the same. The more patients in the health center or in the hospital, mostly is the elderly persons. So about the NCD, non-communicable disease, need a follow-up. When they go every month, maybe they're familiar with that clinic already and they specify about the service because they get the disease, they can meet the clinician by appointment, something like that. And for the younger persons, maybe they join about the health promotion or active service care from the school, such as vaccine, health education, or health preventing programs, something like that. And sex is one the factor that associated with satisfaction of UC. In Bangkok, we found man has higher satisfactions more than woman. Maybe in Thai culture, female is not the leader of the family, but we will the labor, no, not labor. We do anything in the family, such as take care everyone. If children, baby, father-in-law, husband sick, we need to take care this group to the hospital. That means when you need to more contact, that means you suffer from the waiting time, suffer from the information, suffer from the referral system, something like that. They're not satisfied. But for men, maybe they're more patient or less expectancy. And another factor is the education. From this study found that the bachelor degree have the high satisfied of the UC. We try to study more why it's be like this. Maybe the had high the certification and has high certification to uncertified too. It's be like this because the high education maybe high expectancy. They know more information, know more about their rights. They request the right that they choose to get it. But for the low education, sometimes they less attention about the on detail. They focus on the only what thing that they will receive on the health center or the healthcare or the hospital. And about the income is quite similar with the education level. And about the physical health and mental health, it's found that the persons who have the very poor of the physical health and mental health is highest proportions of the unsatisfied. Maybe it's caused from the many factors, such as the severity of the disease require the special treatment. When you require the special treatment, that means you need to go to the general hospital or university hospital. The same problem, it come back, the referral system. You need to ask the letter for the referral, refer the persons to the university hospital. And maybe about the indirect cost. If they live in some district, it's far from the hospital, university hospital, that means they need to pay more money for the transportation. Some family need to ask some persons to take their father or their mother to hospital. That means they need to pay money for indirect cost. And for the information, sort of information, we have some factor that related for with the certification of UC. First is the public mass media. The persons who receive, we get the high certified that I mentioned you. This is the website of the National Health Security Office. They have a lot of the information. If you can approach it, that means you can learn more information, and they have the hotline. And some organizers try to make the website page for give the information for the UC consumer online. In Thailand, line is the very popular message to send. And for the poster is quite the same. And one thing is quite contrast about the public health officer. The persons who receive the information from the public health officer quite low satisfied compared with the persons who not get the information from the public health officer that I mentioned in the previous slide. Very crowded in each day, maybe has work for the office, not have time to give more information for the consumer. And this is the figure that we try to compare the satisfied between 50 districts in Bangkok. If you see this figure, it's very variety. It reflects about the many things. First, about the quality of the service is not the same in each area. And another thing I think is come from about the the area that have the university hospital. That means the persons that area have more chance to register their right in this. Such as this is the area of the Ramathipati Hospital. This is the area for the Siraj Hospital. Okay. From this study, we try to recommend from the Bangkok Metropolitan as administration, try to emphasize advocacy to increase the understand and explain about the exception regarding the UC, and need to improve about the hotline service system because sometimes they think it's not friendly for them. And for further study, we recommend to compare all the security right in the Thailand and try to access about the referral system, what is the problem, what is the limitation, and sometimes it should be to study by the qualitative. You will get the information in the detail that we get some in this study. And last of all, I like to say thank you for the 2016 Kyoto Cobalt Conference and Kyoto University that give special chance for me to share my research. Thank you very much. สวัสดีค่ะ